Hello YouTubers, and thank you for joining us for our weekly interactive coding scenario courtesy of AMCI. These scenarios are recorded live from our classroom in our weekly group study sessions. Each week we will cover a different section from the CPT manual, so please subscribe to our channel so you won't miss out. As we go through the weekly scenario, please feel free to solve along with us to strengthen your coding skills. Hope you enjoy! Here are the tools you will need to solve the weekly scenarios. Your CPT and ICD-10-CM manual. The current year is preferred. However, if you have older versions, feel free to use them. The TTT manual is AMCI's Test Taking Techniques manual, and it is highly recommended when learning medical coding. And also, if you are in a medical coding career already, it is very useful as well. It is AMCI's test-taking techniques and all the important guidelines for procedural and diagnostic coding. It also includes the auditing charts you will see us utilize in our E&M auditing scenarios. You can always download a free auditing chart from the AAPC website. However, if you do prefer the ones that we use, they are included in the purchase of the TTT manual available at amcicoding.com. This week, we will be coding Miss Kelly.
I sure can. A 99203, B 99204, C 99214, D 99244. A 38-year-old female, initial visit, just moved from out of state, has neck and back pain for the last year and is getting worse. Pain is exacerbated when she drives, bends, or changes position, and moderately alleviated with ibuprofen. Positive for aches and weaknesses in her muscles and tingling and numbness of the arms and hands, as well as headaches. All other systems are reviewed and are negative. She has a partial hysterectomy and is divorced. Her mother has a history of breast cancer. The physician performs an exam on the following systems: constitutional, eyes, ENT, respiratory, cardiovascular, gastrointestinal, musculoskeletal, and neurologic. X-rays of the cervical and lumbar spine were taken and reviewed. We'll be sending her to get an MRI and to start physical therapy. Prescription was given for muscle relaxer. Select the appropriate CPT code for this visit. And let's start with 3 minutes, starting now. Okay, that's time, coders.
All right. Thank you, Miss Kelly.
You're welcome.
All right. So for the ones who are still answering, I'll give you a few more seconds to get your answers in. The ones who've already answered, go ahead and let me know, what was your hymn for this scenario? What hymn did you come up with? And we're going to walk through this one together because I know we always learn something new every time we go through these auditing charts. Yes, love it, Jeannie. Great job, Sarmi. Awesome, Lavon. Okay. So we're a little bit split on our answers here as well, but I do see that a lot did get it correct. So these are always learning moments, and this is great. So let's walk through this one. Now, what do you notice when you look at our answers? What do you see? Okay, someone says a new patient, not a consultation. We have new, established, and consult. Okay. 2 new, 1 established, 1 office. Okay, great. So it's always good to recognize these if we can. You know, a lot of the more commonly used one, like those new and established office visit, we're going to recognize those a little bit easier than we would maybe this 99244. But as you're saying, answer A and B is for a new office visit, C is for an established, and D is for a consult. So remember, for a consult, if this were a consultation, we need to fulfill those 2 R's. Okay, so we have to ask ourselves, is this a consultation? Do we have a request and a report? Is this a new patient? Is this an established patient? Okay, so those are some things we want to ask ourselves going into our keywords. So my keywords here, I have 38-year-old, initial visit, neck, back pain, last year, getting worse, exacerbated when she drives, bends, changes positions, moderately alleviated with ibuprofen, positive, aches and weakness, muscles, tingling and numbness, arms and hands, headaches. We have all other systems, negative. We have partial hysterectomy, divorced, mother, history, breast cancer, physician. The physician's exam is going to be constitutional, eyes, ears, nose, throat, respiratory, cardiovascular, gastro, musculo, neurologic. We have x-rays of the cervical and lumbar that were taken, and we have an MRI that's ordered, okay, MRI and physical therapy. Okay, and we have a prescription that was given. So I know in these auditing scenarios, there's quite a lot of keywords, okay, because we kind of need a lot of keywords to get us to the correct answer here. All right, so the first thing that I want to sort through here is I'm going to be able to eliminate some of these answers. First of all, is this a consultation? Well, looking at my scenario, I don't see anything about a consultation. I don't see anything about one doctor requesting another doctor to see this patient. I don't see anything like that. So I know that this is not a consultation. Now, going up here, it says that this is an initial visit, meaning this is a new patient. Okay, this is her first visit, so she would definitely not be established. So that means right off the bat, I can eliminate C and D. Okay, did you guys understand how I got that? Are you following me so far on this? Okay, great. Okay, so we want to try to eliminate as many answers as we can, and then just go from there. So we're not dealing with a whole bunch. So now I've narrowed it down just to my new visits, okay? And this is a new patient office visit. All right, so Now, since it doesn't give us any components of our HIM here, we're going to go ahead and figure it out. Now, first of all, we're going to look at the history table. The history table consists of our HPI, which is our history of present illness, the review of systems, which is the ROS, and past family social history, we refer to that as PFISH, okay? This history table is the subjective part of the report according to the patient, okay? So first of all, I'll ask you guys, we'll do this the interactive way. So for HPI, how many did you guys get? Okay, just for the HPI, just for the top portion here. Okay, so I see some different answers. I see 4, I see 7, 6, 8. Okay, so let's go ahead and go through it. So it says this is a 38-year-old female, initial visit, just moved from out of state. She has neck and back pain, okay? So on our history of present illness, number 1 here, location. Do we know where on the body? And yes, we do, neck and back. Okay, so we're gonna go ahead and we're gonna check that. Okay, we know the location. The next thing that I'm going to check is the duration, because it says, when did the problem begin? Example, 3 days ago, a month, etc. It says for the last year. So we know for the last year she's been having this problem, okay? So that would be our duration. Now, the other thing is if we look at so it's getting worse, and then it says pain is exacerbated when she drives, bends, or changes positions. That would fall under, I would say that would fall under context. What do you guys think? Under what circumstances does it occur when she drives, bends, or changes positions? So I put that under context. And then also the modifying factors here, what makes it better or worse? Okay, example, ice, aspirin, heat, massage. Well, it says that it's moderately alleviated with ibuprofen. So it gets better, slightly get better with ibuprofen. So I put that right there under modifying factors, okay? So for that portion, for the HPI, I got 4, all right? All right, following me on that? Okay, so that number right there, I'm going to take and I'm going to go down to my chart at the bottom, and I'm going to circle under HPI my 4 elements. So that falls under level 3 and level 4. So I'm just going to circle both of those for now, and then we'll figure out at the end which one we're going to go with, a level 3 or level 4, which would be either detailed or comprehensive. Okay, so the next thing I want to figure out is the ROS, okay? So let's go back over here. It says the patient is positive for aches and weaknesses. So according to the patient, she's saying that she has aches and weaknesses in her muscles. So that would be musculo, and tingling and numbness of the arms. That could be neurological. But however, it does say all other systems are reviewed and are negative. So what does that mean when it says all other systems are reviewed and are negative? So what do we do for that? What did you guys get for your ROS? Great job, Joy. Yeah. Woo woo. Good job, Josie. Good job, Sarmi, Amber, Cheryl. Yes, you guys are getting it. Okay, great. So when it says all other systems are reviewed and are negative, all systems are reviewed and are negative, that means all these systems were checked. Okay, so that means we would count all of these systems, whether there was a problem or not. That means that they were reviewed. So anytime it's reviewed and it says all systems are reviewed and are negative, you would just count them all, okay? Hope I'm making sense when I say that. Let me make sure. Do you guys get that? Okay. Okay, perfect. All right, so the musculo, she was positive for musculo and also for the tingling and numbness, but aside from that, everything else was reviewed as well, okay? So all of these are reviewed, so we count all of them. So that basically gives us 14. If we look there at our ROS, we have 14 systems. All of them were reviewed, so that means we get a total of 14. So for our ROS portion, we're going to go down here to our chart and we're going to circle a level 4 because that is a complete ROS. So if 10 or more elements are checked here in this ROS, it would be complete, and we have 14. So yes, it is definitely complete. Now finally for our PFISH, that's our past, family, and social history. What did you guys get for that one? Okay, I'm seeing 3, 2, 1. Okay, a lot of 3s are starting to come in, some 2s. Okay, so let's go ahead and look at this. So going back over here, it says she has a partial hysterectomy. So partial hysterectomy, that would fall under her past illnesses, injuries, operations, treatments. And remember, current medications are also listed for this past history, okay? So partial hysterectomy is part of the past history. So that's one. The next thing, divorced, that's part of her social history, okay? She's divorced, that would be part of her social history. Also, her mother has a history of breast cancer, so that is part of the family history. So we have everything checked here. We have our past history, we have her social history, and we have her family history. So that means all of those are going to be checked, and that gives us a complete PFISH, okay? Because there's 3 there. We're going to go down to our chart. So for 2 to 3 elements for our PFISH is going to be complete right there under level 4, okay? So now we've fulfilled everything in level 4. So that means we can code this as a level 4 history, okay? That makes sense? Which would be comprehensive. So we're going to go ahead and document that. So take your screenshot if you need to, and I'm going to move on to our next page. Because now we're on to the exam. Okay. All right, so the exam, remember the exam, so we document that. We know we have a comprehensive history now. Now onto the exam. This is the objective portion. This is when the doctor actually physically examines the patient. So we're going to go back over here, and it says the physician performs an exam on the following systems. So now this is the exam part. Constitutional. So remember, constitutional is up at the top. It includes blood pressure, pulse, respirations, height, weight, and appearance, okay? Now, it doesn't specifically tell us here if the blood pressure was taken, pulse, and all that stuff. So how do we know? What are we going to mark up for up there at the top box? Yes, that's right, Joy. Yes, you got it, Patricia. You got it, Angela. Yes, Josie. So regardless, remember, if we look here, regardless of the number checked, maximum score is 1. So it doesn't really matter here. It does say constitutional was done. So it could have been all of those. It could have been one of them, 2, 3, doesn't matter. We're only going to count 1, okay? So up there for constitutional, we got 1, okay? All right, so now we're going to go down to the body areas. And it says he examined the eyes. So go down here to the eyes, which is under number 8, and check that. The next thing, ears, nose, throat, that's going to be under number 9. Check that. Musculo is going to be number 6. Oops, sorry, I think I missed one here. Ears, nose, throat, respiratory. Did I miss one? Respiratory, yeah. Respiratory is number 11. Cardio is number 1. Then we have gastro, number 2. We have musculo, number 6. We have neurologic, which is number 7. And I think that's pretty much it. Okay, so then we're going to count those up. 1, 2, 3, 4, 5, 6, 7. We have 7 for the organ system and body area section. Okay, so we're going to add those together. We'll add the 7 here and the 1 from constitutional. That gives us a total of 8. Okay, and so we're going to go ahead and circle that down here. That falls under a level 4, okay, which is 8 or more. All right, and that gives us a constitutional. I think the bottom portion is missing here on this box, but that's if you look in your manual or your TTT manual, you're following along in this exam table, that's a comprehensive, okay? So now I know I have a comprehensive history and a comprehensive exam, so I'm going to document that. And finally, the last thing I need to figure out is going to be my MDM, okay? All right, so we'll walk through this one together. So the first thing with the MDM, we need to figure out the number of presenting problems. So I want to see what everybody got for this one, and then I'll share with you what I got. Okay, great job, Trisha. Okay, so we need to figure out, is this a single self-limited or minor problem stable? Is this an established problem to the examiner stable? Is it an established problem to the examiner worsening? Is it a new problem to the examiner with no additional work at planned? Or is it a new problem to the examiner with additional assessment, consult, or diagnostic studies? Okay, so first of all, I know that this is not an established problem because this is a new patient, okay? So this would be a new problem to this examiner. Now, the second thing I need to figure out, is there going to be additional workup? So is there additional workup for this patient? Yes, Joy, you got it. Yes. So it says that this patient they will be sending this patient to get an MRI, okay? And to start physical therapy. So yes, there is going to be additional assessment, consult, or diagnostic studies, okay, for this patient. So for this one, I got a number 4, okay? So great job, Patricia. So we'll go down here to our chart under presenting problems, and we're going to circle where it says 4. So 4 or more would go under high, okay? Now the next thing, the amount and complexity of data. What did we get for this one? Either review and or order of clinical test, review and or order of CPT radiology section, review or order tests in the medicine section, discussion of test results. There's a whole bunch of other, obtain old records, independent review of image tracing or specimen, and then we have review or summarization of old records. Obtained or obtain history from someone other than the patient. I know that's a little bit hard to read. Very small. Okay. All right, so I see 4, I see 2, I see a lot of 2s, I see 1. Okay. So for this one, if we look over here at our keywords, it says x-rays of the cervical and lumbar spine were taken and reviewed. So that is part of in the radiology section, the x-rays, they were reviewed. So I know that we have 1 for review for the radiology section, and also MRI. He's going to order the MRI, okay? So that would be 2, okay? So we have 1 review of the x-ray and 1 order of the MRI, okay? And those are both in the radiology section, so that is going to give us 2 points here, okay? All right, so I'm going to go ahead and I'm going to circle that over here under amount of complexity of data, okay? So that gives us a low, okay, for complexity of data. Now, last thing we need to figure out is the level of risk. Are we dealing with a minimal, a low, a moderate, or a high? Let me know in the chat. Okay, I'm seeing moderate, 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 low, moderate. Moderate. Okay, I'm seeing a lot of moderates. And what are you basing that off of? I see a low. Okay, Trisha, great. I love that. Okay, Jeannie, yes, I like that. Okay, so it's hard to see, but if you're using your chart, I hope you are, in the TTT manual, under the level of risk, we need to look back at our keywords again and see what's going on. Okay, so the level of risk. Under this, okay, it says the only thing it's really telling us here is that a prescription was given for the muscle relaxer. This prescription is going to fall here under management options selected. So if you look under, I don't know if you can see this, where my cursor's at, it's really, really small, but look at it in the TTT manual, in your risk chart, okay? Prescription drug management. I'm gonna go ahead and circle that, is moderate, okay? Because this patient was given a prescription, it would fall right here under prescription drug management for the management options, and that would justify us coding this as a level, having this level of risk at a moderate level, okay? So we would go down here to our chart level of risk and we would circle moderate, okay? Make sense? Okay, great. All right, now we have low, we have moderate, and we have high. So how do we figure out which one we are gonna use here? Will we take the lowest one? We're gonna take the highest one? Do we take the one in the middle? Someone says we're gonna sing the song. Okay. Okay, yes. Someone says drop the lowest, take the one in the middle, take the next lowest. Yes. So for our MDM table, we remove the lowest and we take the next. So we would take out the low here, and we would take the next lowest, which would be the moderate. Okay. So that would mean this would be a moderate MDM. Okay. Does that make sense? So just think of this MDM table as we need 2 of 3, just like an established patient, subsequent or established 2 of 3. This MDM table follows the same. So like Miss Suzanne saying over there, follow this, sing the song. So sing the song for this. Remove the lowest and take the next lowest. Okay, so this would be a moderate MDM. All right, so now we have the full hymn, CCM. That's our complete hymn here, okay? So we just have to figure out what is the hymn for these codes. 99203 is DDL, and 99204, dun, 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 it's CCM. So look, that's perfect. We don't even have to do anything else. We don't have to pull out that leveling song. We know that this matches exactly. So 99204 is going to be our code. We can get rid of A, and B is the correct answer. Okay? So talk to me. What do you guys think? Is it easy, or do you need a little bit more practice with these? You're kind of getting it? If you like this video, hit the thumbs up and don't forget to subscribe, and join us next week as we code another scenario. If you would like to learn more about AMCI, please visit us at the link in the description. Also, if you have any suggestions or requests, please leave us a comment. We would love to hear from you. See you next week.
Thank you for watching an AMCI exclusive presentation.